3 tips for choosing your Medicare Part D plan with Robert Bache, Medicare Bob. 3 things you should know. The first thing you should know is how to calculate your estimated annual cost for the year based on your current prescriptions. Second thing you should understand is how step therapy works. And the third item is understanding prior authorization. So let's talk about how to calculate your estimated annual cost for your Part D, your Medicare drug plan. A lot of times people want the drug plan that has the lowest monthly premium. Well, that is a mistake because a monthly premium is not the only cost associated with your drug plan. If you've had a drug plan before, you know you're going to pay the monthly premium, plus you're going to pay a deductible, you're going to have co-pays, you might enter what's called the coverage gap or the donut hole, and you're going to have higher co-pays. Based on your medications and the plan's formulary, the cost can change. It also need to take into account which pharmacy. Some people can save money just by simply switching to a network pharmacy or trying the plan's mail order. So when you're looking at how to calculate your estimated annual cost, you want to take all these items into account. So when you're looking at the monthly premium, a $20 drug plan might be more expensive for you than that $35 drug plan because different factors. It might have a larger deductible that you have to pay. Your co-pays may be higher. You might enter the donut hole or the coverage gap because you might have a prescription that's not on that plan's formulary. You might be going to a pharmacy that's not a network pharmacy, so even though the monthly premium is lower, you're paying a lot more cost for all your prescriptions. So whenever you're evaluating your drug plan, the monthly premium is a factor, but it's not the only factor. Okay, I repeat, a $35 or a $40 monthly premium drug plan might have a lower estimated annual cost for you than a $18 drug plan. Because again, the monthly premium is one factor, not the total picture. Okay, so you got to take all these items into account. Does it have a deductible? What are my co-pays on the plan? Are all my meds covered? And am I going to the right pharmacy? Or am I willing to try their mail order option? The second tip or item to understand is what is step therapy? How does it work? So I'll read the definition here, and then I'll kind of tell you how I explain it. With step therapy, in most cases, you must first try certain less expensive drugs that are also approved for use for your condition before you can move up a step to a more expensive drug. Basically what this is if you're taking a prescription and it's costing the drug plan a lot of money and they feel that there are lower cost alternative medications that you could take and would be just as effective, they have the right to require you to try up to 2 medications before they will approve the higher cost med that you're taking now. Now, the reason it's important to understand how step therapy works is companies can pick and choose which prescriptions they want to use step therapy for. So when you're comparing 2 or 3 prescription drug plans, and maybe you have a couple that are pretty close in price, but one of them says, 2 of your prescriptions are going to have to go through step therapy, that might be a reason for you to avoid that drug plan because the prescription you're taking is working, and you may not want to go through the hassle of having to try 1 or 2 other prescriptions just so you can prove the one that you're working or justify the one that you're taking is working. So whenever you're looking at a drug plan, it's important to understand when you look at the formulary, which of your prescriptions, if any, that the drug plan is going to require step therapy for. Now, my third tip, or my third thing that's important for you to understand when you're looking at a drug plan, is what's called prior authorization. This is another tool that the plans use to save money. Again, I'll read the definition to you. Plans may require a prior authorization to make sure certain prescription drugs are used correctly and that only when medically necessary. This means before your plan will cover a certain drug, your prescriber must first contact your plan and show there's a medically necessary reason why you must use that particular prescription drug. I get so many questions about this, just based on the definition, that you have to get a letter from the doctor who wrote the prescription for you that it's medically necessary. A lot of people have a hard time wrapping their head on how this makes sense. Because of course it's medically necessary. That's why the doctor is prescribing it. So again, when you're evaluating which drug plan to choose, you want to look at the formulary, look at the list of prescriptions that you currently take, and see which plans would require a prior authorization for certain medications that you're taking. Because again, each plan can choose which prescriptions they are going to require prior authorization for and which ones they are not. So again, if you're evaluating, let's say you have 2 or 3 plans that look pretty similar in price, but let's say one of the plans requires 2 of your prescriptions to get prior authorization for, and then another plan that might even be a little more expensive for the year doesn't. That'll be a choice you have to make. You can choose to pay, definitely get the best value, but then understand you got to go through that hurdle of prior authorization. Well, in my experience, if it's just a few dollars, some people rather avoid that hurdle altogether. But the important factor is that when you're picking your drug plan, you understand which of your prescriptions, because they do give that information to you, that the plan is going to require prior authorization. So estimated annual cost, step therapy, and prior authorization. Those are 3 important things to understand. My tip is you understand all 3 of those and how the plan you're going to choose will impact and you choose the right drug plan. So here's how we help. Senior Healthcare Direct, we do this all for you. There's a link to this video or below a video or above it that's going to be labeled, it's going to be a link to our Part D Finder form. This is a really cool service that we do for people. You're going to complete that form. On that form, it's going to ask you basic information, a list of your prescriptions, the frequency, the dosage, and which pharmacy you're getting that prescription filled at. We will then put all that information into our system, and it will show us which prescription drug plan will have the lowest estimated annual cost. So it's going to, which Part D plan will save you the most money. It's going to calculate the monthly premium, your annual deductible, your cost share. So that's the copays you're going to pay, if you're going to hit the donut hole or when you're going to enter it. Which plan will you spend the least amount of money over the time that you're on that plan for that 12 months for the year? Which plan are you going to save the most money? We'll calculate that for you. We're also going to review which of your medications are on the plan's formulary. And this is how we will help you either avoid step therapy and avoid prior authorization, or at least set your expectation that you're going to have to go through that process for those prescriptions. Because once we enter in your medications, it's going to show us right then and there, here's the 2 or 3 most cost effective. And again, we can evaluate is there one prescription that you take that all the plans require step therapy for, or maybe there's a plan that we can help you get to avoid the step therapy or the prior authorization. But even in my experience, people really like just having that expectation set. Here's your most cost-effective drug plan. Here's your one medication that's going to require prior authorization. Go ahead and get ahead of this hurdle. Also, with your list of prescriptions, we're going to take a look at the pharmacies. You're going to send us a list of your 2 preferred pharmacies. We're going to enter them in. We're going to shop, see if it can save you money. Some people are surprised to find out that you could easily save $300 to $1,500 just by switching pharmacies or trying a mail order process. And again, we'll give those options to you because a lot of people love the pharmacist they go to, or they dislike mail order, or they love mail order, or whatever their preference is. But we're at least going to give you the information so that you can make the right choice. So based on that, our Part D Finder form that you complete, and based on the list of your medications, we will answer all these questions for you. We will then email you and contact you with your top Medicare Part D options. We do this free of charge. We do not charge you anything for this service. It is free to you. We are paid by the insurance companies to evaluate and enroll you into plans. However, with the drug plans, we do this for free of charge, and it doesn't cost us anything or cost you anything to work with us. But we do hope to to earn your Medicare supplement business, because we do this for our current clients every year, and it's a service that we do for them for free because they are our Medicare supplement clients, and in return we help them with their Medicare Part D drug plan. So that's how we help. And if you'd like our help, please select the Part D finder form, complete that, hit submit, and then within about 2 weeks during the annual election period, we will actually send the information to you with those options, and we'll contact you and we'll help you get the most cost-effective and the right drug plan for you. Again, my name is Robert Bache. Thank you for your time. If you found this helpful, please like it and share it on Facebook or on YouTube. If you have any questions, please leave a comment below and we'll answer your questions.